You are one of the most caring people in your life, and that care is quietly making you someone you don't recognize. Here's the paradox. The people most likely to lose themselves inside someone else's pain aren't the ones who haven't done the work. They're the ones who have. The more psychological awareness you develop, the more another person's suffering registers in your body as if it were your own. The more inner work you do, the more you feel personally responsible for outcomes that don't belong to you. The deeper your capacity for empathy becomes, the more it stops being empathy and starts being something far more complicated. Watch what that actually produces. Someone you love is struggling, and you spend more energy analyzing their situation than they do. You replay conversations about their life in your head at midnight. When they make a choice you can see is wrong, something in you tightens, not just with concern, but with a kind of urgency that feels almost like threat. And when they don't change, when they stay stuck, when they choose the same thing again, you feel it as failure, your failure. Carl Jung called this participation mystique, a state of psychic fusion where two separate selves collapse into one, where the boundary between your inner world and someone else's dissolves completely. He observed it in his patients. He wrote about it in his therapists. And he was unsparing about what it revealed. Not love, exactly. Something older and less conscious than love. A need wearing love's face. What you're about to hear will be uncomfortable, not because it questions how much you care, but because it will show you what you've been doing with that care, what it's actually been protecting, and what you've been refusing to see about yourself by staying so focused on saving someone else. You have done this thousands of times without noticing. Someone you love is in pain, and something inside you, fast, automatic, older than any conscious decision, moves toward them, not beside them, into them. You don't witness their suffering from the outside. You absorb it. Their crisis becomes your crisis. Their sleepless nights become your sleepless nights. Their problem migrates across the boundary between you and settles into your chest like it belongs there. Most people call this empathy. They're proud of it. They see it as evidence of depth, of love, of psychological seriousness. And for a while, maybe it is. But there is a point where something shifts, and most people never catch the moment it happens. Carl Jung observed this in the clinical setting and named it with a term he borrowed from the anthropologist Levi Bruhl: participation mystique. A state of unconscious identity between two people, where differentiation collapses and the psychic boundary between self and other simply ceases to function. Jung was careful to locate this not as a pathology of the weak, but as a primitive state of psychological organization, one that every human being is capable of falling back into, especially under the pressure of intense emotional proximity. In the practice of psychotherapy, he was direct about the cost. The doctor who becomes psychically fused with the patient doesn't just risk their own equilibrium. They forfeit something more fundamental, the very separateness that made them useful in the first place. Think about what that means outside the consulting room. When you fuse with another person's process, you are no longer present to them. You are present to a version of them that has been filtered through your own fear, your own urgency, your own unresolved material. You stop seeing what they actually need and start responding to what their suffering activates in you. The help you offer from that place isn't calibrated to them. It's calibrated to the discomfort their pain is producing inside you. There is a specific feeling that marks this crossing. It arrives as a kind of low-grade anxiety that doesn't fully belong to you. A restlessness about someone else's life that follows you into rooms they're not in, that surfaces at 3 in the morning, that makes their silence feel like emergency. You notice it when you realize you've spent 20 minutes constructing an argument they should have in a conversation you're not part of. You notice it when their good news relieves you more than it delights you. Once you know what to look for, it becomes unmistakable. That feeling is not love overflowing. It is a boundary that has already been lost. What makes participation mystique particularly insidious for psychologically developed people is precisely this. It doesn't feel like confusion. It feels like clarity. It feels like seeing someone more clearly than they see themselves. The certainty you feel about what they need, about what they should do, about the path they're failing to take. That certainty is not insight. It is the symptom. It is what fusion feels like from the inside, dressed in the language of wisdom. And the more psychological vocabulary you have at your disposal, the more convincingly you can mistake your own projection for perceptive understanding. But if the cost were only emotional exhaustion, if this were merely a question of burnout, the solution would be rest. Take a break. Come back when you're full again. Jung's framework points somewhere more unsettling than that. Because the question isn't only what this is costing you. The question is what you're actually doing to the person you're trying to help. And what this impulse, when examined with real honesty, reveals about what you've never finished resolving in yourself. If this content is making sense to you, click the subscribe button and subscribe to the channel. Thank you for your support. Most people assume projection is something that happens in extreme situations: jealousy, paranoia, irrational anger. They don't consider that it might be the invisible architecture underneath their most generous impulses. Jung understood projection differently, not as a dramatic distortion reserved for moments of obvious irrationality, but as a constant, structural feature of the undeveloped psyche. The mechanism by which contents of the unconscious that we have not yet claimed in ourselves get cast outward and encountered as if they belong to the external world. In 2 essays on analytical psychology, he was precise about the mechanics. Projection attaches itself where there is a hook, something in the other person that resonates, however faintly, with something unresolved in you. The resonance is what makes it feel like clarity. That's exactly what makes it so difficult to catch. Now apply this to the impulse to save someone. When you look at a person who is struggling and feel not just concern but urgency, a driving need to intervene, to fix, to accelerate their healing, the question Jung would ask is not, how much do you love them? The question is, what aspect of your own unfinished process are you looking at? Because the specificity of that urgency is always diagnostic, the precise shape of someone else's suffering that you find most unbearable, the particular pattern in them you cannot leave alone. These are not random. They map onto something in you that has never been fully traversed. This is one of the most disorienting insights in Jungian psychology, and also one of the most verifiable. Think about the person in your life whose situation you have found most impossible to step back from. Now ask yourself, is there any version of their struggle that echoes something in your own history that you never fully resolved? A fear you never faced down, a choice you deferred, a part of yourself that is still, somewhere, waiting? The answer, if you're honest, is almost always yes, not metaphorically, concretely. Jung named this with clinical precision in the practice of psychotherapy when he described the 4th stage of analytical work, transformation, and its central demand that the doctor cannot help the patient advance further than the doctor himself has gone. The formulation is simple and devastating. One cannot help any patient advance further than one has advanced oneself, not because of insufficient technique or insufficient care, because the unresolved material in the helper becomes the ceiling of what the helper can offer. What you haven't worked through in yourself is not neutral. It actively shapes what you see in the other person and what you do with what you see. This means that your most intense helping relationships are, in part, attempts to solve something. The person you are most desperate to rescue is carrying, in some form, a version of what you most need to understand about yourself. When you pour energy into their transformation, you are trying to resolve, at a safe distance, through a proxy, something that can only be resolved from the inside. Their healing becomes a stand-in for yours, and because it can never actually function that way, the urgency never fully dissipates. You help them through one crisis and find yourself waiting, almost unconsciously, for the next one, because the need you are trying to meet was never really theirs to meet. What this means for the person on the receiving end is something we haven't yet fully examined, because Jung's framework doesn't stop at what projection costs the one who projects. It goes further, into what it costs the one being seen through someone else's unresolved material. That's where this becomes not just psychologically complex, but ethically urgent. Suppression is not the only way to violate another person's psychological process. You can do it with love. You can do it with full presence, genuine concern, and the best intentions available to a human being, and still be interrupting something that was never yours to touch. Jung was categorical about this, and the categoryness of it is important. The process of individuation, the movement of a human psyche toward its own wholeness, is not something that can be accelerated from the outside, improved upon by an informed observer, or transferred from one person to another through the force of someone else's care. In 2 essays on analytical psychology, he described it as a natural process that proceeds according to its own internal logic, its own timing, its own sequence of necessary confrontations. It follows a direction that the conscious ego frequently cannot see and would often resist if it could. The process knows something the person doesn't, and it certainly knows something you don't. Think about what this means when applied to someone you love. When you look at their situation and feel certain you can see what they cannot, the pattern they're repeating, the choice they keep avoiding, the thing that is obviously keeping them stuck. What you are actually looking at is their ego's current position. You are not seeing their whole psyche. You are not seeing what the unconscious is arranging beneath the surface of the stuckness. You are not seeing what the stuckness itself might be preparing. Jung treated this with clinical seriousness. In the practice of psychotherapy, he wrote about cases where the most rational intervention, the one that seemed obviously correct, the one that reason and common sense demanded, turned out to be precisely the wrong move. Not because the observation was inaccurate, but because the timing was wrong, or because the resistance being encountered was not an obstacle to the process, but part of it. What looks like someone failing to move forward is sometimes someone gathering exactly what they need for the move that's coming. You cannot see that from the outside. Nobody can. The word Jung uses in these moments is autonomy. The psyche has its own autonomy, its own governing intelligence that operates independently of the conscious will, and crucially, independently of what anyone else has decided would be best. When you override that autonomy with intervention, with pressure, with constant presence that makes the other person's process dependent on your participation, you are not helping them heal. You are substituting your timeline for theirs. Your vision of their wholeness for the one their own self is working toward. This is where the violation becomes invisible even to the person committing it. Because the impulse doesn't feel like control, it feels like dedication. It feels like refusing to give up on someone. But dedication that cannot tolerate the pace of another person's process, that intensifies when they don't respond the way you expected, that becomes anxious when they seem to be moving in a direction you didn't plan, is not dedication to them. It is dedication to an outcome you have decided on their behalf. The practical question, then, is not whether you should stop caring. It is whether you can distinguish between presence and occupation. One leaves room for the other person's self to do its work. The other fills that room completely and leaves no space for anything to happen except what you already imagined. What that distinction looks like in practice, how you learn to occupy the first position and recognize when you've slipped into the second, is precisely what we're building toward. But to get there, something else has to be named first. If what you're hearing resonates with you, you'll find real value in my ebooks. Beyond the Shadow breaks down Jung's core ideas, while Dialogues with the Unconscious gives you a 30-day path to apply them in your life. Both are linked in the pinned comment. Most people, when they hear "stop trying to save people," interpret it as an instruction toward indifference. Pull back, care less, protect your energy. But that reading misses the entire weight of what Jung was pointing at, and it replaces one problem with another. The distinction Jung drew was not between caring and not caring. It was between two fundamentally different modes of presence. One that serves the other person's process, and one that, despite every good intention, quietly replaces it. He described this in clinical terms, but the underlying principle extends far beyond the consulting room. A therapist who has not done their own psychological work doesn't stop affecting the patient. They affect them unconsciously, through the unresolved material they bring into the room, without knowing it. The help they offer is contaminated not by malice, but by proximity to their own unfinished business. In the practice of psychotherapy, Jung made the demand explicit. You cannot help another person advance further than you yourself have gone. The ceiling of what you can offer someone else is the floor of what you haven't yet faced in yourself. What he was describing, underneath the clinical framing, is the difference between a presence that witnesses and a presence that substitutes. The witness holds space without occupying it. They remain a separate self, distinct, boundaried, genuinely other, which is precisely what makes them useful. Because the other person can only encounter themselves, can only confront what's actually theirs, when there is a genuine other to encounter. When you dissolve into someone's process, when your self becomes indistinguishable from their struggle, you take that away from them. You become a mirror so close to their face, it can't reflect anything. The substitution mode has a specific texture, and it's recognizable once you know where to look. It feels like urgency that doesn't resolve when things improve. It feels like relief at their progress that is slightly too large. Because the progress was relieving your anxiety, not just theirs. It feels like the relationship having a kind of charge that can't quite settle, because something in you needs it to continue. You can track it precisely. In the substitution mode, the other person's stability threatens the helper's sense of purpose. In the witness mode, it doesn't. What witnessing actually requires is harder than anything the substitution mode demands. Because substitution is busy, and busyness is comfortable. Witnessing requires you to tolerate their pain without immediately trying to resolve it. To trust a process you cannot control and cannot see the end of. To remain present to someone who may not be changing at the pace you believe they should, without that stillness collapsing into passivity or abandonment. It requires, above everything else, that you have enough of a separate self to bring into the room, that you have done enough of your own work, that their unfinished business doesn't immediately activate yours. This is not softness. It is a discipline. It demands more psychological maturity than intervention does, because intervention at least gives you something to do. The witness has nothing to do, only something to be. And here is the paradox that Jung's entire framework is quietly building toward. The moment you stop trying to save someone is often the moment you become genuinely useful to them, not because you stopped caring, because you finally have enough distance to see them clearly, as a separate person, with their own self, their own timing, their own interior logic, that was always more intelligent than your urgency gave it credit for. What comes after that recognition isn't emptiness. It's something considerably more difficult and considerably more real. Something unexpected happens when you stop, not immediately. The first thing that happens is discomfort, a specific kind of restlessness that arrives when a habitual motion is interrupted. The urge returns. You catch yourself reaching for the phone to check on them, composing the text you've decided not to send, running the calculation one more time. The body doesn't know yet that you've changed the rule. It keeps moving toward the old shape. But beneath that discomfort, if you stay with it long enough, something else begins to surface. Jung was precise about what this moment contains. In the practice of psychotherapy, he described what becomes available when the doctor successfully separates their own psychic process from the patient's, when the fusion dissolves and two genuinely distinct selves are again present in the room. He called it, simply, the possibility of real influence. Not the counterfeit influence of someone who is fused and therefore managing rather than meeting. Actual influence, the kind that only becomes available when you are sufficiently separate to be genuinely encountered. You cannot truly meet someone you have merged with. You can only manage them, or be managed by them, or oscillate between the two. What this means practically is something most people discover with a kind of quiet shock. The moment you stop trying to carry someone else's process, you become more present to them, not less. Because you are no longer in the room with a version of them filtered through your projections, your urgency, your unresolved material. You are in the room with them, as they actually are, where they actually stand, at the pace their own process is actually moving. That is when you can see clearly enough to be useful. Not useful in the way you were trying to be before. Useful in the way that actually lands. There is a second thing that happens, and it's harder to sit with. When the projection lifts, when you withdraw the contents you had cast onto another person's struggle, those contents don't disappear. They return. They come back to the place they always belonged, which is your own interior. The grief you were managing through someone else's healing now has to be felt directly. The fear you were outrunning by staying focused on their crisis now has nowhere to hide. The aspect of your own individuation you had been trying to complete at a safe distance through them now stands in front of you, waiting. This is not punishment. In Jungian terms, it is precisely the work. The withdrawal of projection is not an ending. It is the beginning of the real process, the one that was yours all along. And what becomes possible in that process is something the saving impulse could never have produced. Not the resolution of someone else's struggle through your intervention, but a genuine reckoning with your own. The two people in the relationship both get something real. You get yourself back. They get to keep their process, unoccupied, intact, moving at the speed their own psyche has always known was right. What that makes available, for both of you, is something that has been waiting just beyond the edge of everything you've been doing. That's where we're going now. There is a moment, quiet, almost anticlimactic, when you realize the person you were trying to save was partly a fiction, not a lie, not a delusion, a fiction in the precise sense, a character shaped less by who they actually are than by what you needed them to represent. And the moment you see that clearly, two things happen simultaneously. You see them differently, and you see yourself for the first time in a long time. Jung's framework does not end with the withdrawal of projection. It begins there. Because when you stop pouring your psychological energy into someone else's process, that energy doesn't disappear. It returns to its origin. And what it finds when it arrives back is the work you've been postponing. The fear you were managing at a safe distance, the grief you kept at arm's length by staying useful, the question about your own life that you made unanswerable by filling every quiet moment with someone else's crisis. This is not a punishment. It is a return. In the practice of psychotherapy, Jung wrote something that functions less like clinical observation and more like a verdict. The doctor can no longer evade his own difficulty by treating the difficulties of others. There is no gentler way to say what that means. The helping, in its compulsive form, was always partly evasion, and the thing being evaded was always yours. Specific, personal, waiting with a patience that has nothing to do with forgiveness and everything to do with the nature of the unconscious, which does not give up. What comes after the recognition is not emptiness. People fear it will be. They believe that if they stop organizing themselves around someone else's need, there will be nothing left. No purpose, no direction, no sense of being necessary in the world. But that fear is itself part of the complex. It is the unconscious convincing you that you do not exist independently of your function. Jung would call that the surest sign you have not yet met yourself. What actually comes is presence. Not the performed presence of someone who is busy being attentive, but the real thing. The presence of a person who has enough of a self to actually show up, who can sit with another person's pain without absorbing it, accompany their process without substituting for it, care without the caring becoming another form of control. That is what Jung meant by witness, not distance dressed up as maturity. Genuine contact between two separate selves, which is the only kind of contact there actually is. The person you become on the other side of this is not harder. They are more honest. They are capable of a love that doesn't need the other person to stay broken in order to feel necessary. They can be present to someone's growth without needing to take credit for it. They can hold space without filling it. And they have begun, finally, specifically, with no proxy available, the process of their own individuation. That process doesn't announce itself. It doesn't feel like a rival. It feels like sitting with something uncomfortable and choosing not to reach for someone else's life to make it bearable. It feels like the beginning of a much longer conversation, one you've been postponing, one that only you can have, one that nobody else can save you from. If what this video uncovered is still moving in you, the one appearing on your screen right now will take it further. Click and keep going.